Oftentimes, goals for a new year revolve around our health. But even if 2 weeks into this year, your resolution's already fallen flat, that doesn't mean staying healthy is any less important. This week, we're highlighting issues of health in America.
It's completely changed access. Everybody can remember 3 numbers.
Why there are new concerns about our children's mental health.
I get emotional when I tell this story.
And we'll break down the startling new numbers when it comes to maternal health. This is The Race. The way we view COVID-19 today is very different from a couple of years ago. And while many people may have put the pandemic behind them, we've come to Memphis to meet with a group that is still doing outreach efforts with the vaccine to get a firsthand look at the front lines of COVID-19 in 2023.
Mr. Tuggle, come on in, hop on up here.
For as routine as a vaccine appointment may feel these days,
This is gonna be his booster.
and as light as Ted Lyons keeps them,
What we do for Steeler fans is that we use large needles.
he is serious about making sure we know this work is still important.
You're in media, you know, it lasts 2 cycles. If it's not on the news cycle, the last 2 times you watch the news, they're not thinking about it anymore.
Ted and his wife, both pharmacists, launched this clinic in 2021.
And we really went all 10 toes in and used our 401ks, everything, say we're gonna start this clinic.
Today, they're still working to make sure COVID vaccine access is fair, especially for Memphis's Black and brown communities, groups often at a higher risk for pre-existing conditions.
You have people who have multiple problems, you know, everything from diabetes, hypertension, asthma is really big in Memphis.
So you're seeing a lot of people come in here who have problems that COVID could still be a very serious issue.
Exactly.
Do you still worry about COVID?
Yeah, because I had a brother that died from it.
I'm sorry to hear that.
Yeah, I had a brother that died from it 2 years ago, so yes, it's important.
Loss may drive Stephen Tuggle to get his shots, but much of Ted's work is vaccinating people at outreach events.
This is the battery packs that run them. These battery packs last 12 hours.
In 2023, portable freezers like these make it easy to transport doses to areas that don't have easy access to pharmacies.
And we have to go to where people are. And that's why we started this, where we wouldn't be just a brick and mortar clinic, but we'd be primarily mobile. We go everywhere.
Only about 1% of COVID cases in the U.S. today are deadly, according to Johns Hopkins.
It is different now. Our world is different.
I checked in with rural Michigan ICU nurse Michelle Hurd. I last spoke with her in 2021 when she was treating a COVID surge. Then she told me most of her patients wouldn't survive. But today she says you can count the amount of COVID cases in her unit on one hand, although cases have risen in certain parts of the country in recent weeks.
My world will always have COVID in it. I just plan on it. It's what we should do. We should always be looking for what's new in the research, how we can better treat these patients.
Mr. Taylor, how are you doing today? Doing good. Come on through here.
For Ted and the patients we met at his clinic, their answer to moving forward in a world with COVID is a mindset many have had from the beginning.
I don't know if it's going away or when will it go away, but if it's out there, I want to be sure that I'm covered and I don't want to, hurt someone else.
The road to recovery after a trauma like enduring a mass shooting can take months, years, even a lifetime to heal from. But we spoke with a survivor who wants us all to know it's possible to heal from these things no matter how long that road may take. Sitting in his hospital room with bullet wounds in his back and leg, Ed Sanders still finds the energy to smile. The LGBTQ advocate is known in the community as Prince Royal.
And the emperor gets a slightly larger one.
He's a survivor of the Club Q mass shooting in Colorado Springs. He was shot right next to Kelly Loving and Derek Rump. Both didn't make it.
I survived somehow. We just kind of tried to help Kelly breathe and encourage her to hang on and stay with us. But she passed. It was only 2 minutes before they got there.
The impact of that moment and the entire experience has scarred him.
I couldn't sleep for 3 days. Then I decided, I made up my mind that I would put that off to the side until I got healed. And once I'm healed, then I would deal with all that.
He says he's planning to start trauma therapy as soon as he's out of the hospital. He knows healing his body and his mind is the only path to live the life he loves once again.
I made it through this awful experience, and it's for a reason. I've got work to do here.
The hard truth is the idea of going back to the pre-traumatic event normal may be difficult. That's a long road.
We spoke with UC Health clinical psychologist Justin Ross about how to start the path to healing. He says survivors like Ed may experience things like bad dreams or intrusive thoughts, feeling jumpy or on high alert, heightened emotions, and wanting to avoid the scene or talking about the trauma.
You put them all together and they really can create a lot of distress for people for weeks and sometimes for months to come.
But these are all normal reactions, and Justin says even for those of us who saw this happen on television or online, we can feel that trauma too.
It can be re-traumatizing for any and all of us to see this happen, especially if we have a prior history of trauma.
He says we all should normalize that it's okay to be upset and it's okay to reach out for support.
Normalizing that, it gives us a chance to talk about it. It can also help us seek out the help and the treatment that we need for our own healing and recovery.
Ed says he's normalizing his pain by talking about it and leaning on the fighting spirit he's had his entire life.
I've always been a fighter. When I came out at 23, there was no gay movement or anything. I think it has enabled me to be that strong person.
He says incredible community support has also made him strong. And he hopes we can all find some strength, no matter how fleeting it may be, in talking about trauma and reminding ourselves every day that in time and with the right support, hurt can be healed.
It's not hopeless. I will never be defined by hate.
In Colorado Springs, I'm Alexa Liacco.
Our country has a very high maternal death rate. Coming up, we take a look at a new study and the solutions being suggested.